An intro music fades in and then fades out quickly. Hello and welcome. Today we're diving deep into the world of ophthalmology to explore a rare and challenging eye condition, serpiginous choroiditis. This inflammatory disease can seriously threaten vision if left untreated, so understanding it is crucial. We'll cover everything from its causes and symptoms to diagnosis and treatment options. Let's embark on this informative journey together. Now, let's talk about what causes serpiginous choroiditis. Unfortunately, the exact etiology remains elusive. It's classified as an idiopathic inflammatory condition, meaning the precise cause is unknown. However, researchers suspect a complex interplay of factors is involved. These include potential autoimmune responses, where the body's immune system mistakenly attacks healthy tissues in the eye. While specific genetic predispositions haven't been definitively identified, some studies suggest a possible hereditary component, meaning it might run in families. Additionally, environmental factors, such as certain infections, have been proposed as potential triggers, although concrete evidence linking them directly to the disease is still lacking. Let's delve into the pathophysiology, or how serpiginous choroiditis actually damages the eye. The disease primarily affects the choroid, a layer of blood vessels located beneath the retina. Inflammation within the choroid disrupts its normal function, leading to damage and death of retinal pigment epithelium or RP cells. These RP cells are crucial for supporting the photoreceptor cells in the retina, which are responsible for vision. As the inflammation spreads, it creates a characteristic snake-like or serpiginous pattern of lesions in the choroid and RP. This progressive damage disrupts the blood supply and nutrient delivery to the retina, ultimately leading to vision loss if untreated. The inflammatory process can also involve the outer retina, exacerbating the visual impairment. Serpiginous choroiditis is considered a relatively rare condition. Accurate epidemiological data is limited due to its infrequent occurrence and potential for misdiagnosis. However, it's estimated to affect approximately 1 to 2 people per million worldwide. While it can occur at any age, it's most commonly diagnosed in individuals between their 40s and 60s. There doesn't appear to be a significant difference in prevalence between men and women. The condition seems to affect all races and ethnicities equally, although further research with larger populations is needed to confirm this. The signs and symptoms of serpiginous choroiditis can vary depending on the location and extent of the inflammation, but some common indicators exist. Blurred vision is often the first symptom patients notice, gradually worsening as the disease progresses. Patients may also experience metamorphopsia, which is a distortion of straight lines, making them appear wavy or bent. Another common symptom is scotoma, or blind spots in the visual field. These blind spots can be central or peripheral, depending on the location of the lesions. Some individuals may also experience photopsia, which are flashes of light. Eye pain is usually minimal or absent, which can sometimes delay diagnosis. In more advanced cases, significant vision loss can occur, potentially leading to legal blindness if left untreated. It's important to note that symptoms can develop gradually or suddenly, and may affect one or both eyes. Diagnosing serpiginous choroiditis requires a comprehensive eye examination and often involves several specialized tests. A thorough medical history is crucial, including any history of autoimmune diseases or infections. A dilated fundus examination allows the ophthalmologist to visualize the retina and choroid to identify the characteristic serpiginous lesions. Fundus photography is used to document the appearance of the lesions and monitor their progression over time. Fluorescein angiography often involves injecting a dye into the bloodstream and taking pictures of the blood vessels in the retina and choroid, helping to identify areas of inflammation and leakage. Indocyanine green angiography, ICGA, provides a better view of the choroidal blood vessels, which are often obscured by the retinal pigment epithelium and Fa. Optical coherence tomography (OCT) is a non-invasive imaging technique that provides cross-sectional images of the retina and choroid, allowing for detailed assessment of retinal thickness and structural changes. In some cases, blood tests may be performed to rule out other conditions that can mimic serpiginous choroiditis, such as tuberculosis or syphilis. While there aren't formally classified types of serpiginous choroiditis based on distinct clinical features, the disease can be categorized by the location and pattern of the lesions. Some classifications are classic or geographic. Serpiginous choroiditis involves continuous, snake-like lesions spreading from the optic nerve towards the periphery. Macular serpiginous choroiditis primarily affects the macula, the central part of the retina responsible for sharp, detailed vision. Peripapillary serpiginous choroiditis starts near the optic nerve and spreads outwards, often sparing the macula initially. A typical serpiginous choroiditis presents with unusual lesion patterns or characteristics that don't fit the classic presentation. These descriptions are helpful in understanding the disease's varied presentation, but they don't necessarily dictate specific treatment approaches. The primary goal of treatment for serpiginous choroiditis is to control the inflammation and prevent further damage to the retina and choroid. The cornerstone of treatment is systemic corticosteroids, such as prednisone. These medications help to suppress the immune system and reduce inflammation. However, long-term use of corticosteroids can have significant side effects, so they are often used in combination with other immunosuppressive agents. These include medications like azathioprine, cyclosporine, mycophenolate mofetil, and methotrexate. These drugs help to further suppress the immune system and allow for lower doses of corticosteroids to be used. Anti-TNF agents, such as infliximab or adalimumab, may be considered in patients who do not respond to other immunosuppressive therapies. These medications target specific inflammatory molecules and can be very effective in controlling the disease. Regular monitoring by an ophthalmologist is crucial to assess the effectiveness of treatment and adjust medications as needed. This includes frequent eye exams, fundus photography, FUD-A, and OCT to track the progression of the lesions and any potential side effects of treatment. Unfortunately, there's no known way to completely prevent serpiginous choroiditis, given that the exact cause remains unknown. However, individuals can take steps to maintain overall health, which may indirectly reduce the risk of developing autoimmune conditions. These include adopting a healthy lifestyle with a balanced diet, regular exercise, and adequate sleep. Avoiding smoking and excessive alcohol consumption is also recommended. If you have a family history of autoimmune diseases, it's important to be aware of the potential increased risk and discuss it with your doctor. Early detection and prompt treatment are crucial in minimizing vision loss from serpiginous choroiditis. If you experience any sudden changes in your vision, such as blurred vision, distortion, or blind spots, seek immediate medical attention from an ophthalmologist. The prognosis for serpiginous choroiditis varies depending on several factors, including the severity of the disease, the location of the lesions, and the promptness and effectiveness of treatment. Without treatment, the disease can lead to significant and irreversible vision loss, including legal blindness. However, with early diagnosis and appropriate treatment, many patients can achieve good control of the inflammation and preserve useful vision. Relapses are common, even with treatment, so long-term monitoring and maintenance therapy are often necessary. Recent research focuses on understanding the underlying mechanisms of the disease to develop more targeted and effective therapies. Studies are investigating the role of specific immune cells and inflammatory molecules in the pathogenesis of serpiginous choroiditis. New imaging techniques, such as adaptive optics imaging, are being used to visualize the retina and choroid at a microscopic level, providing a better understanding of the disease process. Clinical trials are evaluating the efficacy and safety of novel immunosuppressive agents and targeted therapies for the treatment of serpiginous choroiditis. The hope is that these research efforts will lead to improved outcomes for patients with this challenging condition. Outro music fades in. Thank you for joining us on this journey into understanding serpiginous choroiditis. Remember, early detection and proper management are key to preserving vision. If you suspect you may have this condition, please consult with your ophthalmologist immediately. Outro music fades out slowly.